This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. Russia has offered North Korea COVID-19 vaccines once again. This is as lockdown and other restrictions are reportedly leading to severe hunger in the country. Russian leader Kim Jong-un has also acknowledged that the country is currently facing food shortages, describing the situation as tense. Jong-un made the comments last month and also told citizens to prepare for the worst ever outcome, which has invoked comparisons to a deadly famine in the 1990s. It is also widely believed that international trade sanctions also aggravated the pressure on food supplies. UN Secretary General Antonio Guterres says a global vaccine plan is essential and should be put in place immediately so as to bring the pandemic under control as death toll hit 4 million. Guterres, who announced the current death toll in a statement, said that the global death toll due to COVID-19 officially passed 4 million late Wednesday, marking yet another grim milestone and underlining the urgent need for a global vaccine plan. The Director General of the National Agency for Food and Drug Administration and Control, Professor Mojisola Adeyeye, said the agency is currently being audited by the World Health Organization in preparation for local production of the COVID-19 vaccines in Nigeria. Adeyeye stated this in Abuja on Wednesday at the maiden interaction with stakeholders organized by the House of Representatives Committee on Safety Standards and Regulations. The NAFDAC DG said the agency is supervising 165 pharmaceutical firms and over 45,000 food manufacturing companies, over 5,000 micro, small and medium-scale enterprises in the food and drug industries. And as the coronavirus hits hard in Tokyo, the Olympic Games in Japan are expected to take place without spectators. The Olympic Minister Tamayo Murukawa made this known after intense discussions with officials and organizers on Thursday. A state of emergency has also been declared in Tokyo so as to fight the coronavirus menace in the country. And the Nigeria Center for Disease Control has announced the first confirmed case of the SARS-CoV-2 Delta variant, also known as lineage B16172 in the country. According to the NCDC report, the confirmed case is a traveler who came into Nigeria and underwent the routine travel test required of all international travelers and genomic sequencing at the NCDC National Reference Laboratory, Abuja. Recall that TOS Television Network in June 2021 reported that the World Health Organization declared the Delta variant of the COVID-19 as a variant of concern, given its increased transmissibility. And this is TOS Television Network and you're watching Health 54. Just stay tuned. Welcome back. You're watching Health 54. Study has shown that reducing global heating could save millions of lives and prevent them from being infected with mosquito-borne diseases. According to the reports, more than 8 billion people could be at risk of malaria and dengue fever by 2080 if greenhouse gas emissions continue to rise unabated. It is projected that malaria and dengue fever will spread uncontrollably to reach billions of people. Also, at least 4.7 billion more people could be threatened by the world's two most prominent mosquito-borne diseases, compared with 1970 and 1999 figures. And Indonesia's government has ordered producers to prioritize medical oxygen amid a COVID surge and shortage of oxygen in a number of cities. Hospitals say they have almost exhausted supplies, with one reporting that 63 patients died as a result of oxygen shortages. Indonesia is currently recording more than 25,000 new cases every day. Increased travel and the highly contagious Delta variant have exacerbated the crisis. And in a bid to ease the burden of the deadly HIV and AIDS disease on positive patients, especially the orphans, Governor Babajide Sanwo-Olu-led government in Lagos and the United States Agency for International Development have set up an association for reproductive and family health, integrated child health and social services project. The project, according to a statement made available to newsmen on Thursday, was to mitigate the impact of HIV and AIDS on orphans, vulnerable children and their caregivers in the state. Lagos State First Lady Dr. Abijoke Sanwo-Olu made this known in Ikeja while commending the U.S. aid for the resources deployed in the Orphan and Vulnerable Children project in the state. And over 750,000 new persons have reportedly embraced family planning in Taraba State. The move, which experts described as a welcome development. According to the Taraba State Director of the Challenge Initiative, Sariki Othman, he disclosed that the number is the highest since the last 3 years. Othman made the disclosure in Jalingo on Thursday during a media roundtable on sustaining and advancing the gains of family planning in Taraba State. He said the achievement was made possible through deliberate efforts at sensitization and enlightenment carried out during the period, but noted that a lot more needed to be done so as to sustain the achievement. And no fewer than 17 persons have lost their lives in Ebonyi and Plateau states following an outbreak of cholera disease in the states. The Ebonyi state government announced that 3 persons died from cholera in the state, while 12 other infected persons were currently being treated in hospital. Meanwhile, the situation is worse in Plateau State, where at least 14 persons have been confirmed dead as a result of complication from cholera outbreak in the state. And that is Health of 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.